May is Stroke Awareness Month, so it's important to know the warning signs and what you can do to stay healthy. That is why we are joined by Dr. Devin Simon, a neurologist with the Novant Health Forsyth Medical Center. Doctor, what are the most common warning signs of a stroke?
Hi, thank you for having me. What we try to educate our patients in the community on is to recognize the acronym Be Fast. The idea is that stroke symptoms happen quickly. They aren't things that happen over days to weeks, but suddenly in the moment. And so, part of this acronym, we ask patients and families to be mindful if there's a sudden loss of balance, if there's vision loss, if someone has a facial droop or weakness or numbness on one side of the body, changes in their speech, and then even more importantly, what time all of these symptoms happened.
At what point do you go to emergency care? When you have all of those, or if you have just one of those?
Strokes have a variety of different presentations, and so what we ask is that if anyone has any of these symptoms, that the next best step, the next best thing that they can do is call 911. And the idea with that is that if someone can get to the hospital quickly and we can identify that someone is potentially having a stroke, then we can start to determine if they can be a candidate for a variety of different acute stroke treatments.
Okay, so that's what we do if we have a stroke. What are the major risk factors that make us at risk of a stroke?
What we found over time is that almost 80% of strokes in the general population can be preventable, and it's often related to risk factors that have been highlighted by Life's Essential Eight, which is a paradigm from the American Heart Association that focuses on things like high blood pressure, tobacco exposure, cholesterol, diet, and exercise. And so, what we found is that if some of these can be addressed under the care of a healthcare provider, we often have the best chance for our community to be protected from having a future stroke.
If someone was going to take one step today to reduce their risk, what would you tell them to do?
I would ask that anyone, even starting at an early age, should have general health screenings with a healthcare provider because we often don't know what risk factors each individual person may be at risk of having. And so, by having annual checkups, physical exams, checking blood pressure, checking cholesterol, making sure that people, if they have diabetes, that's under control, by aggressively attacking these risk factors early, it can prevent someone from having a TIA or a stroke.
You know, we hear a lot about strokes, but I think a lot of people don't know exactly what they are. What is a stroke?
A stroke essentially is an event where there is loss of blood flow to a part of the brain. And it can be a variety of different arteries that can create a lot of different stroke symptoms. Sometimes these symptoms come and go, and there's no evidence of damage to the brain, and that essentially is a TIA. But other times there's actual irreversible loss of brain cells, and that ends up becoming an ischemic stroke. So, what we can do is by getting someone to the hospital as quickly as we can, there are options for treatment to try to return blood flow and try to prevent someone from having a major stroke.
Are there any misconceptions about strokes that you want to clear up?
What I often hear from patients and family is that someone may have had a recent or history of a mini stroke, which in my mind may suggest that it is less severe. But what I try to educate patients and folks in the community is that we should treat every TIA and ischemic stroke very seriously. We don't know what are the mechanisms that may have caused that stroke, and these patients may be at risk of having a more severe, potentially disabling or life-threatening stroke. And so we want to make sure we attack all risk factors that we can to optimize treatment.
Well, thank you for being here today. We appreciate you talking about this important topic.
Thanks
If you want
again.
to
Take care.
If you want to share this with your family or friends who might be at risk also, it will be up soon in the 2 Wants to Know section of WFMYnews2.com.